As the first ever female sports editor of the Harvard Crimson, Laura Schanberg had a brief notion of becoming a professional sports broadcaster.
But I just decided that that wasn't enough, and that I wanted to do things that contributed to society more than that.
So she pursued medicine like her father Saul, a noted Duke neuropsychopharmacologist for 41 years. She since has become a pioneering pediatric rheumatologist, helping to forever change the way children with rheumatic diseases are treated. Schanberg was 8 when her father joined the Duke faculty in 1967 and moved the family from Connecticut.
And my mother thought we were moving to the end of the world, moving to Durham from New Haven.
The family would soon grow to love the area, and there was no question where Schanberg wanted to go to medical school.
From a very beginning, Duke has been about family for me.
She graduated Duke Medical School in 1984 and stayed for residency, fellowship, and additional training, then joined the faculty.
When I was doing my family medicine rotations, realized that I really didn't like taking care of old people. And I kept trying to go into the rooms with the kids. So it took me a little while, but I figured out that, I didn't have to do that all the time. I could just go see the kids all the time. And so that sort of directed me into pediatrics.
Her impact on pediatric rheumatology has been transforming. In the early 1990s, she was the first physician to document the severity of pain that children with arthritis were having.
The pain that they were having was often overlooked, and I did a series of studies to show how much pain that children were having on a daily basis.
In 1997, she was a founding member of the Childhood Arthritis and Rheumatology Research Alliance, or CARA, leading the effort to enhance the quality and amount of pediatric rheumatology research.
Because it's always been an underfunded subspecialty, and we needed to get together to be able to study rare diseases, which all of the pediatric rheumatic diseases are pretty much rare diseases.
She led development and implementation of CARA's 60-site registry to capture disease-related data to help create standardized treatment protocols. The database is now 12,000 strong. Schanberg obtained the first NIH research grant for the CARA organization and was the principal investigator for the APPLE trial, the largest randomized controlled trial in pediatric lupus.
The APPLE study is about using statins to treat children with lupus and try to prevent the cardiovascular disease that they get as part of their disease.
She has helped to grow the CARA organization from an annual budget of $200,000 to $10 million a year. But one of her most cherished roles is that as mentor to the next generation of pediatric rheumatologists.
I like to mentor people far enough along in their career that they have some ideas about what they want to do.
Schanberg's husband Larry is a clinical psychologist. They have a daughter, Katie, and a son, Colin. The Schanbergs have 2 grandchildren. Schanberg has replaced her tennis racket for a pickleball paddle, and she can often be seen on the court with fellow awardee Diana McNeil. She also likes to knit.
So I make baby blankets and bigger blankets and bigger blankets.
She says that Duke runs deep in her family and herself. Her mother Rachel started the Duke Cancer Patient Support Program in 1987, following the death of Laura's sister Linda.
It's really hard to, separate out Duke from my life in general. Duke has very much been part of many aspects of my life.